Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medi Spa. Welcome to Bellissimo Live. Today, we're going to talk to a patient of mine. You may have seen her before, Michele Tedder. So Michele has been on this with me before. She's a nurse by training and has gone through a weight loss program and has lost a lot of weight. And we first met several years ago, and she's already had a paniculectomy with me, and that's taking the extra skin off of the lower part of her abdominal wall, so that develops when you lose a lot of weight. But today we're going to talk about, she is now 12 days post breast reduction and liposuction of her chest wall, so that on the sides underneath her armpits, on that area. So she's just 12 days post-op, and I was commenting that she's looking pretty good for the Facebook Live. But I wanted to just sort of introduce, what that would be to a patient who's just been through it and still in the healing process. And so, Michele, thank you again for doing this, especially in the acute post-op period. But that's even better because it makes you more honest. You haven't forgotten anything yet. So, you've been through the paniculectomy, and you and I have been talking about this surgery for a while, and then, just with your busy schedule and everything else, it was just sort of time to do it. But what was the motivating factor for you to want to do the breast reduction? Again, we've talked about it for a while.
So, yeah, we've been talking about this for like over 2 years, I think. We've been talking about doing this. I think that for when you have a lot of weight loss, like the skin left behind is pretty significant. And I think that the one thing that I have learned on my journey and continue to learn is that you don't have control over what the elasticity of your skin is going to do. You don't have control over like where the weight is going to come off. So, so those are all the kind of things that nobody tells you before you have weight loss surgery. And
Right.
it's not that I have any regrets, because I don't. I've told you that before. I have no regrets about it. But I do think it's important for people to understand that, because a lot of us who are in these bodies, right? We do a lot of looking on Facebook. We do a lot of looking on IG, and it's like, oh, I want to look like that. And this is going to be like, it's not like that. I
Right.
just want to keep it real and say that what you see on Instagram may not be what you see when you look in the mirror before or after you do any of these surgeries. So I think that's the one message as a patient I would want other people to know, is that you need to have realistic expectations and also accept the fact that your body is your body, right?
Mhm.
And there's factors that are going to play in what that looks like, your age, what your body was like even before you did all of these things. I mean, there's just a lot of things that play into it. So I think that it's important for people to kind of come in with an open mind and know that your situation is highly individual, and that the most important thing is to make sure that you have a surgeon who, one, sees you and really understands what is specific to you and your goals, and that you work together to do that. So
Right. And I think that's important too. Like you said, there's, you know, dealing with expectations is the hardest part. And I think, social media can be a double-edged sword, because there's stuff out there. And I think patients really have to understand that, a lot of what they're seeing is the best of what anybody's showing. And we all do that. But, not everybody is built like that. And sometimes, patients have a better, body habitus for certain things more than other people. And as you said, there's lots of factors, including a patient's genetics and their age and their skin tone. And again, it really is where the weight is. So sometimes the procedures take that procedure and maybe some touch-ups or something else. So, and as the surgeon, we try to really get to the heart of what the patients really are going after. And we want you to do well. We want you to be happy. I mean, that's the reason we do it. And so, the the surgeries, like you had the paniculectomy,
Mhm.
And the breast reductions can really help change somebody's life, because, not just from the rashes and the
Mhm.
irritation and all of that, but really just putting your body back into balance so that you feel better and go about your functional day-to-day activities with less pain, less fatigue. And so, of the two surgeries, I think you might find this one to be actually in the long run a better
Mhm.
fit for you as you go through the healing process. So, as we go through this, so at 12 days out, you're basically just starting to lay down a lot of scar tissue and things are starting to heal. The first, few days, your body's trying to figure out what happened. So you get a lot of swelling and as a breast reduction, as we talk with patients is, it'll take 5 or 6 months for the shape to really take over again. In the meantime, what you find is that, functionally you feel better, but the
Mhm.
aesthetics aren't there yet. And that takes more time. So in the, you said, it was just sort of this, motivating factor.
Mhm.
Was it mostly pain? Was it, that you were getting just from day-to-day activities? What was really that motivating factor for you to
Yeah, I want to go back to that because I know we were talking about, what I wanted to make sure people understand.
yeah.
Manage your expectations. So that's the first thing. But going back to what you said, there was a couple of things. I mean, you know me well and personally, but I think one thing is that the more weight that I lost, the more elongated and deflated my breasts became. So
Right.
what that meant was they were longer, like past my belly button longer. Like I was surprised when you did the markups. I was like, oh my God. Like I knew, but to see it, I'm like, wow.
Mhm.
But the big thing that was happening that I honestly didn't always connect the dots between was my low back always hurt. Always. It always hurt. And so and I have a history of low back pain, but I think that as the breast deflated and got longer and all that skin, the more chronic it was. Like it had gotten to the point that I would alternate like my exercise routines because I like to go to the gym and I like to walk. When the weather's nice outside, I love to walk outside, but I would have to, if I did the walking outside on a Monday, then I would skip a day do something else like ride on a stationary bike or whatever because my back would hurt that much. So I think between that, the rashes in the summertime, and just the aesthetic, there were even clothes that, I'm buying a 2X sometimes on the top because the breasts were just not gonna fit in anything else. So there was like several things, but I think the thing that is most astounding to me is since you did the surgery 12 days ago, like I'm like, my low back pain is gone. It's crazy. And I'm like, wow, like that really did have a part in what was going on. And you'd said that to me. You said, well, you're leaning forward, your chest wall is so heavy. But
Mhm.
I was just so used to, just compensating
Just
for it.
right. This has
It was,
been years of that for you.
yeah, it was years of
And
it.
a lot of women, right? So, and a lot of women get, tension headaches because you're using your bra as a hoist. You're trying to lift your breast back up onto the chest wall. So the only way to do that is pull down on the shoulder straps of the bra, which causes a lot of grooving. And
Mhm.
then that trapezius muscle that kind of runs up the back of your neck and onto your shoulder. There's lots of women have headaches that just really get a lot better or go away after this surgery.
Yeah,
That tension goes away.
I didn't have the headaches, but I definitely had the markings on my
Mhm.
shoulders. And then I tell you that I would be out of a lot of money when it came time to bra shop. I was out of a lot of money.
Right,
I had to walk
because
out
those
with
are all
just two or
special
three
bras, right?
because I had to have, right.
And they don't last long.
Right. Well, I literally went to a specialty shop in Atlanta to get
Mm.
my bras because they did not have that size. I was a 40J before you did this. So I don't know what I am now, and I guess I won't know for a long time, but I'm definitely not that. So
Yeah, and that's another thing that women need to know. I mean, we really don't talk cup sizes because there's really no way. There's so many variations in cup sizes amongst bra companies. So to try to fit somebody into a C, a D, a double D is virtually impossible. So, really we just sort of balance out, the patient's body habitus and try to make a breast that is not just only functional, where you take the weight off and they feel better, but also it has to look good too. And that's the key thing. So, it's still the most feminizing part of your body. And we want to make sure that we can do some aesthetics. And it can be difficult, especially the longer the breasts are, the more complications can be there. And so, as we talked about before, sometimes you can have an issue with blood supply to the tissue, the nipple, the nerve supply, and you've come through with everything healing beautifully so far, and you really don't have any issues. You have good sensation. Nipples and the areola are viable. Everything looks great. So it's just your swelling so far.
That's it.
Right?
That's the only thing. I feel like I was in a fight and I didn't win, Dr. A.
Yeah. So, and we were talking, so the interesting thing is when you do a breast reduction by itself, generally speaking, the pain really isn't too bad. Most women will say it's more uncomfortable. But when you add the liposuction, that's where you're feeling most of the pain, right?
It is. No, I mean, for the most part, I have to tell you, when I woke up, it felt like a toothache in my chest, right? But the pain meds, like the first few days especially, I was very pleasantly surprised that I was not that uncomfortable. But I think, again, like we're talking about the liposuction, because there's so much swelling, and as you explained to me when I came in, that because you're removing so much tissue, that causes just a lot of assault, I guess, to the body. But it's that area more so than anything. Like you kind of feel like a linebacker because there's the swelling underneath your arms and things. But no, for the most part, like I have feeling. That was one of the things I was worried about, was I thought, oh no, I'm not going to have feeling anymore. But I have full feeling. That's not gone at all.
Yeah, and I've had some ladies that have long elongated breasts where they don't have any sensation anymore, and then when you do the breast reduction, and so again, for patients or potential patients that are thinking about this, breast reduction is actually a lift and a reduction. It's two surgeries in one, so it accomplishes both. And so, but I found on several occasions when you lift the breast back up and you take away that bulk and reestablish the anatomy, some of the times the sensation comes back for those women, and they hadn't had sensation for years. So it can work the other way as well. So
that's great. That's great. But no, I haven't lost any sensation. And again, of course, if I touch them, they're sore. But no, for the most part, that's not the issue. It's more the swelling on the sides.
Right. So now I'm one of the surgeons that I use drains for this surgery. A lot of my colleagues don't, and I've done it both ways. I just feel like my patients are a little bit more comfortable with that fluid that those drains pull away. And so we did your surgery on a Friday, and then I saw you back on Monday. So just literally 3 days later. So talk to us about the drains, and because that's one thing that patients really worry about.
I have to tell you that I was pleasantly surprised this time, because you used drains when you did the paniculectomy. And I think the one drain when we did that was in for 3 weeks, but I had just a lot of fluid going on and stuff. But this time, I barely felt them, to be honest. They really, because sometimes they feel like they're pinching. I didn't feel any of that. And then you were able to pull them out, I think, within 5 days. And it was fine. I really don't have much complaint about the drains this go round. So I don't know if you did something different, but it really wasn't
the same style of drain. So there's lots of different styles of drains. And so I always tell patients at the beginning, I don't use the drains that hurt. The drains I use are phenomenal, and they just slide right out. And, but I think that's a problem for a lot of patients when they say you're going to use drains, because they've either had a drain before, or they've been told the drains are very painful. But I like them in certain cases, and this is one of them. But again, the experience is they generally just slide out.
Yeah, it was really pretty painless. That was not an issue at all. So
Good. So what about now with bras? And I basically have you in a sports bra for the next 4 or 5 weeks, or a post-op bra that you were in. So how is that fitting? Has that been a problem for you or anything like that?
No, and I will say that your girls are awesome in the office because ahead of surgery, I talked to them and I'm like, I don't like, should I have extra bras? Because I'm like, that surgical bra, it does get pretty gross, Dr. A.
Hmm.
That's
Right. You
first
get that little
couple
bit
of
of
days.
drainage. Yeah.
Yeah, it
Yeah.
gets pretty
Absolutely.
gross, but they told me the ones to get and they've been fine. And quite frankly, it feels better to have something on.
Support. Right.
Just yeah, to sleep in them and everything. So I guess my best piece of advice to anybody is to do what I did. I ordered like 6 of them after
Hmm.
I tried the first 2 to see how they were. And then I went ahead and ordered a few more because you will need to change them because you still have some drainage and all of that kind of stuff, even after the drains are removed and you're healing. So you want to be able to change them out. But yeah, they were awesome in terms of telling me which ones to get, and I keep them on 24/7, I can
Hmm.
take my shower and put them back on, and, yeah, that's actually it's almost like, an orthopedic kind of a
Right.
thing, right? Like if you have surgery on any other, like joint, like a knee or something, you need to have some sort of support, and it feels the same way. I would liken it to that, is that you have to have something to kinda support because when they're loose, that doesn't feel good.
Right. And so, and then as you start to heal more and more and your body's producing its own scar tissue internally, that becomes the internal support. And so you'll
Mhm.
find that in a while, you really, you'll be able to sleep without a bra in probably 2 or 3 weeks. And
Mhm.
then as the day goes on, you just use it or any kind of bra you want to use. And then there's times you can go without a bra. You can certainly sleep without a bra. So there's a lot of differences that you probably didn't have even before the surgery.
Oh, no, let me tell you, like, to go without a bra, that's funny.
Right.
I haven't done that since I was probably 16, and I've been
Right.
16 in a minute, but,
Yeah.
so I can go without, you are the man,
Yeah,
so,
right.
yes,
And
yes.
but that's what women, again, I think women get told a lot, growing up that if you don't wear a bra to bed or you don't wear a bra all the time, that you start getting sagging and everything else. But after this surgery, when you heal up, I mean, there are times if you want to be without a bra, that's certainly okay.
Yeah,
It's not going to like go back to where it was,
yeah, which is great.
Yeah. And so, and the other thing is, when the tissue that we take out, it gets sent to the pathologist. And so, I definitely look at that. And I'm also, as you know, a stickler for mammograms. But I think women that are contemplating it, that are 40 and over, I think you should have a recent mammogram because you just never know. And the problem is with large breasts, sometimes if you do have something that's starting to appear as a growth or a tumor or a cancer, you may not know about it. And
Mhm,
so because it's very difficult to do breast exams. Now,
mhm.
in the future, 9 months to a year from now, when you're back ready for your next mammogram, yeah, we will definitely get a follow-up mammogram because I am a stickler for that. I think women need to be surveilled, but it will be easier actually because now you have less breast tissue to be examined. So I think it's a safer, um, a better exam for you in the
Yeah, I
future.
look forward to that because we would wrestle them into that machine. I was
Yeah,
just laughing,
absolutely.
when the girls were like picking them up and putting, I mean, they were a lot. So
Right. And you
it'd be
had
interesting.
yeah, you still had a lot of breast tissue too. And so again, to get a really good look at that is hard. And I've done, I don't know, several thousand of these in my career. And I tell you, it's such a well tolerated procedure.
Hmm.
And women, it really does help women, again, for on the functional side, the aesthetic side, clothing options, and so, and also just activity wise. So,
Oh
you
yeah,
know.
even my balance feels different. Like I can get up and like go and
Mhm.
not like have to, I would stand for a minute. I'm like, all right, let me make sure my back is right or whatever. But now
Right.
I can kind of get up and go and I'm like, oh, this is very different. It's very refreshing.
Yes. Well, listen, so the good thing's coming for you. So everybody knows. In about 3 weeks, I'm going to let you start doing some light exercising. So usually things that are non-impactful. So no running, jumping, or jogging, but you'll be able to do stairmaster, elliptical, spin, cycle, so you can get your heart rate up. You can start doing more stuff around the house. you're going to start feeling back to your energy level between 3 and 4 weeks, back to your old self. But now, even with more vigor by the end of the afternoon, even though you're still in the throes of healing, you're going
Yes.
to feel a lot better, even more than you do now. And so
Mhm.
it'll be pretty impressive to watch you go through this. And
Yeah.
so far, so compare and contrast this, to the paniculectomy.
So, well, it's interesting because I feel like of the surgeries that I've had, that one took a little longer in terms of the healing process. And I
Mhm.
think just because it's such a long incision,
Incision, right?
right? Because it's hip to hip,
Mhm.
and there's just a lot more work. My healing was fine, but
Mhm.
I do think that it was a little bit harder. And plus, your core is more involved, right, with
Right.
that surgery. So I think I would you probably released me to go back to work in about 4 weeks. Um, but fortunately, I have a desk job. I don't know that that would have been possible had I been doing something that was more
Right.
physical and
Physical.
manual.
Mhm.
I would say with this, the core, I mean, it's funny because I feel like it kind of helps your core because you're not carrying all that extra.
Right.
So I feel like getting out because like my family keeps saying they're like, you're like off and go. Like, what are you doing? Like you're like off and going. But
Right.
I think that the extra weight that's in your chest, you don't realize how it's impacting your mobility, right?
Right.
So and again, I would say that with the drains, this was a lot less painful, a lot shorter.
Mhm.
Um, and I think that overall, energy wise, this one might be a little bit trickier, I feel like, because I don't know if it's just because of all the work that you had to do with lipo and that kind of thing, but you do start to, as I was moving around a little bit yesterday, and I noticed I was like, I'm really tired now. So I feel like the fatigue may be a little bit different with this one. But overall, I would say balance wise, mobility wise, you almost see that almost instantly. It's very interesting.
Yeah. Well, it's good. Well, I'm glad you have a little bit of fatigue because I know you're an energy, person. So, I need you to heal a little
I
bit.
know you need me to sit out. I know,
Yeah,
boy.
exactly. So, to sort of kind of finish it up with patients, as you gave a little bit of advice before, tell them, what's your advice? Is there anything that you would do now, preoperatively different, or any advice on, kind of getting through it? Bras, as you kind of brought up before, would you, it's hard to get bras before the surgery. And so I try to tell patients that, but
Yeah, I think my best piece of advice is manage your expectations
Mhm.
about, what it's going to look like, what it's going to be, because I think that's a big thing, especially as a woman, right? Because
Right.
what you have the after picture in your head. You don't have
Mhm.
the
Right.
after right after surgery picture in your head. So manage that expectation. I think as far as the bras, I think that you're going to come home with the surgical bra,
Right.
but talk with your physician's office and find out what do they recommend. Your office was fabulous and they told me exactly which one, and those have worked. And they actually told me what size, not so much the cup, but to allow for, because you have to allow for the swelling, right?
Right.
So you're not going to be that's the other thing. Just know you're not going to know your normal bra size right away. That's going to take a minute. But having the sports bra, um, and having a couple extra so you can change. You can't change it until you tell us to change it.
Right. Mhm.
Right. But when you can, it's nice to have a couple because as you're healing, there's still going to be some seepage and some of those, incisions, that kind of thing. So just be prepared for that. It's not terrible. It's just that you need to be prepared for that. And I'm a little bit of a diva, so I like to change things. So, like, so
Good.
if you're wired that way, you definitely want to be able to have that, but understand what it is and also rest. Just get your mind right around you're not going to be able to be lifting things. I did this right before the holidays and I'm a busybody and I love to be able to be in the mix.
Mhm.
but I had strict orders that that was not my story this year, and that was fine. But you
Yeah,
really have to embrace that this is the time and kind of see it as like it's your time of self-care,
right.
right? You
That's
know,
great advice too, because people will do surgery and then try to get back to things too quickly. So,
yes,
and I would reiterate what you said, but I would say whoever your surgeon is, stay close with them, follow
yes,
their post-op, really take care of yourself. Protein intake is important for
very
healing,
important.
but it's great advice that you gave, and I appreciate you doing this. And so I'm just we wanted to sort of help, if women are thinking about it,
Mhm,
what would be the things that they want to know
mhm.
strictly, right from a patient, especially immediately post-op, because, down the line, you're going to be back to your normal activities and all this will just be, a memory. But right now you're in the throes of healing. And
Oh,
so
and
it's the
fluid.
perfect time.
Lots of fluid, I
Absolutely.
would
Yep.
say also, lots of fluid, just because it takes a while to get all that anesthesia
Mhm.
out of your system,
Right.
get like your digestive system going. So I would definitely say lots of, and good, good food in terms of like fiber, prune juice is your friend, all of those
Mhm.
kinds of
It's the
things.
best thing, especially when you're on the narcotic.
Yeah, especially when you're on the narcotics. So I would say just have all of that stuff on hand and be okay with sitting down and relaxing because your body will tell you, because it definitely lets me know, like, listen, girl, this is not what we're doing right now. So,
Right. Absolutely. You
and
need
that's
2 or 3
okay.
weeks of just
Hmm.
letting your body and just allowing it to heal.
Yes,
So, well,
exactly.
again, I thank you so much, and I will be
You're
seeing
so
you in the
welcome.
office soon. So, but thank you for anybody who is joining us, and stay tuned for our next Bellissimo Live. But hopefully tonight version of Bellissimo Live was helpful, and you can follow us on all social media, visit our website, and or call us. Again, thank you again, and we'll see you next month.